Hey, what's up, everybody? Today is Sunday, May 16th, and just wanted to make a quick video about MD Anderson and the process of your first visit, the process of getting confirmed as a new patient, and your first visit to the hospital. Because for me, my first visit was on Friday, and I didn't know what to expect. I didn't know anything. I had no clue what was going to happen, and it was very apprehensive. I got anxious all week leading up to it, and just wanted to tell everyone kind of what to expect in your first visit. So this is 2021. This is May, and for me, prior to getting into the hospital for the first time, I had to take a COVID test 48 hours before you get seen. So that just means that get a COVID test, real simple. And then, so I got the COVID test done on Wednesday, got the results back same day. One thing that's amazing about MD Anderson is they have an app called MyChart, and that chart is updated constantly. So I took my COVID test at 9 o'clock on Wednesday. By 2 p.m. same day, Wednesday, I had a message in my phone, new test result. Open up the app, clicked on it, COVID test negative. So good to go. So for Friday morning, I had to be there at 9 o'clock for registration, and my meeting with the oncologist was at 10. So got there 8:30. MD Anderson's a big campus. My appointment is in the main building. So got to the main building. You walk in the door, and they direct you to it's like 8 or 9 different stations of check-in. So you walk up, you give them your date of birth, your last name. They verify you have an appointment that day, and they give you a green wristband, which means that you've been screened, you've been checked in, and then they tell you where to go. So for me, I had to go to the 6th floor. There's elevators are alphabetical. I don't know what it goes up to, but it's A, B, C. I took A, B, and C on Friday, elevators, but so I took elevator C up to the 6th floor and follow the signs for lymphoma. Tough thing about COVID is you do this on your own. No visitors are allowed. So I would have loved for Sarah to be there with me, but COVID. So go to the 6th floor. It's MD Anderson, and I'll say it again, everybody is polite. They're friendly and polite. You ask a question, you get a sincere answer, not some stereotypical short crap. So go to the 6th floor, follow the signs, get to the lymphoma center. There you check in again. Real simple process. They ask you your first and last name. Your medical ID records number is something that I guess you're probably going to have to not memorize, but that's kind of what they ask, is your medical record number. But for us, for the new people, no idea what that was. It's on my wristband. So you give them your first and last name, and they check you in and say, okay, you're going to, again, on the app, everything is, all your pre-appointment questionnaires, any kind of paperwork is all on the app. So when you get there, you're pretty much set. You don't have to do anything because you have it all on your app. There was one questionnaire that I needed to fill out in person. It took 3 minutes, turned it back in, and waited to be seen, which I thought was the next step would be the doctor. Turns out the next step is actually another registration process. So you go from signing in at the front desk to actually meeting with a lady that will check you in. And she does just general questions, checks your address, you get a picture taken, so that when they scan your bracelet, once you get your medical ID bracelet, when they scan it, your picture will pop up. It's another great form of, another layer of protecting their patients. So you get your picture taken, chit chat for about 10 minutes, not even 5 minutes, and then go back into the waiting room. And within another 10 minutes, they called me in. First thing we did was height and weight, stepped on the scale. And you meet, so this is the first introduction to your team of your oncologist team. I met Lydia, who was my one of the nurses. So she took me to the height and weight, did that. She took me into one of the little offices there, the doctor's rooms, and she just kind of asked general questions, chit-chatted, and then a couple minutes later, nurse practitioner Camila came in and introduced herself. She's a nurse practitioner. She was working side by side with Dr. Lee, and asked more questions about how I'm feeling, some symptoms, what brought me in, what spiked the reason to go, get my lymph nodes. I have stage 4 classic lymphoma. What led me to go get that checked? Any other symptoms? Fatigue, diet, weight loss, night sweats. So we talked for about probably 10 minutes, and then she went to get Dr. Lee and met Dr. Lee. So Dr. Lee is my head oncologist. Good dude, younger guy, pretty full of life. He's hyper. He gets after it. So we sat there and talked for overall about probably 45 minutes. And what he did is he just broke down, before we got into, again, in my head, I'm thinking, I'm going to walk in and they're going to tell me I have stage 4, it's in my bones, I have X amount of time to live. That doesn't happen. To me, it didn't happen to me. And what I mean is that Dr. Lee did put the cart in front of the horse. He sat there and he broke down what lymphoma is. He breaks it down your body. He goes over your scans. So, before you get to MD, you're going to have PET scans and CT scans, and you're going to get these results, and you don't know what the heck they mean. You have no idea, because most of us aren't doctors that can interpret what these scans mean. So what he does is he starts from the beginning. He asks you about yourself, what you do, your background, where you come from, because he wants to get an understanding of who he's dealing with. So we talked about that, and then we got into cancer. And what he did was he broke down the cancer from the inception. For me, lymphoma. Went over the scans, put it into terms that I could understand, and walked me through a lot of the questions that I have, and probably most of you guys have too, because it's you get this diagnosis and you WebMD and you Dr. Google stuff, and you don't know anything because you put in lymphoma or breast cancer or colon cancer, and you get every answer across the board on good stuff to bad stuff, and it'll mess with your head. So one thing that I intentionally did not do, I found out it was stage 4 on Monday before I met the doctor on that following Friday. I really didn't get into my phone. I didn't tell a lot of people because I in my opinion, and just like the doctor said, everybody was raised on, he said the name of a TV show, and General Hospital. I've seen it, older show, but so most people were raised on General Hospital and WebMD, so they don't know stage 4 from stage 1. They don't know what a lymph node is compared to a tumor. People just don't know, and it's not because they are silly. They just don't know because they are not exposed to the information at this level. So, so one piece of advice is, don't get into your phone. Don't WebMD. Don't Google stuff. It doesn't really help at all. and it's hard with friends and family too, because you want to talk and you want to vent and you want to open up, but it's for me, it's hard to open up on a subject matter that most people don't have any knowledge in, and all the stuff that they're going to say is just speculation from stuff that they heard. So, little piece of advice. So anyway, Dr. Lee, great dude. Explained the cancer, explained some of the options we have with chemo, the side effects, everything. I mean, everything. But it was at a snail's pace, and it was comprehensible, and it was just what I needed to hear. Because like you guys, if you're scheduled to go see your oncologist, or you just got diagnosed, it is terrifying. It is heartbreaking. It's brutal, man. It's just absolutely brutal. But I'll say this: I'm at the beginning stage of this journey. There's a lot of roads that we're going to go down, and some of them will be bumpy. All of them will be. It's just part of life. But stay positive. So back to the doctor. I'm getting off topic. I apologize. So talked to the doctor, explained everything. I had my wife, Sarah, on FaceTime on one phone, and I was recording on the other phone. So I don't know medical procedures and politics and policies, but because of COVID, they won't let a visitor come with me. So they're okay with FaceTime, and they're okay with recording, so I did that. I had some notes on my phone, pre-written out that I could ask. Yes, you can record, and you can FaceTime with a spouse or a family member. So met with the doctor, and he said, okay, so chemo has some side effects, different types of side effects. So I figured after meeting with the doctor that was going to be the end of the day. It wasn't, and it was very cool because we need to get some more lab work done. A full, I don't know about full, but a more in-depth blood samples, which were literally, if I stopped talking to the doctor Lee at 1:00, he ordered labs, EKG, and a lung test at 1:00. Walk out of his office, and pops up on the app. Boom. Go to elevator C, floor 2 to get your lab work done. Walk out of his office. A, B, C elevators. Jump in elevator C. Go down to floor 2. Walk out. It's I can't remember the name of the room that you get your labs done, but in any case, it's right there. Walk in, sign in. 3 minutes later, Mr. Bilski, come on back. Walk back. Amazing people in there. They do this every day. We were chatting. They see 1,000 patients a day in that where they take your blood. I know there's a big word for it. I'll learn that too. They see 1,000 people a day. So they are on it. They're good. They're efficient. They're productive. They are on it. And they are friendly. They're laughing. They're joking. They're having conversations about positivity, just positive stuff. Not, you don't walk in there and everybody's quiet and mundane. It's such a good environment. Sit down. I think they took about 9 vials of blood. In this process of cancer, I've been poked for needles probably 10 times in the past 3 weeks, between CT scans and surgery and x-rays and stuff. This guy was a pro. Sat down, give me the ball and the spongy ball, put the tourniquet on, or whatever you want to call it, hit the vein first time. We talked, we joked, done. Pros, freaking pros. So that got checked off on my app. Did that. Another amazing thing about this hospital. So after I got done with Dr. Lee, three tests were scheduled: the lung test, the EKG, and the blood samples. I don't know how it happens, but within a minute of walking out, my phone rang, and it was MD Anderson, and it was, "Hey, Joe, this is somebody. Go to, I don't know if you have the app or not." I said, "I do." She said, "Okay, well, it's on your app, but just head down to floor 2, elevator C, and get your blood work." Okay, cool, done. Looked at my app, it was on there. Followed directions, boom, got there, no problem. While I was getting my blood drawn, he was filling up the vials of blood. My phone rang again, MD Anderson. "Hey, Joe, this is so-and-so. Your EKG is scheduled for now." I said, "Okay, I'm getting my blood drawn." She was, "Yeah, no problem. When you get done with your blood, go to elevator B to the 4th floor. Follow the signs for EKG." Again, big word, don't remember what it was, EKG. On the app, on the phone, cool, done. Walked out, elevator 30 feet away, 4th floor, got off, walked straight into the room, signed in, said, they asked, "What's your last name?" "Bilski." "Joseph?" "Yep." "Done." Should be a couple minutes. Walked out, walked up and down the hallway a little bit, just kind of reading some signs, getting familiar with the campus. 8 minutes later, called my name. Took me straight back. Courtney was the tech, and yeah, she just straight into her room, started the EKG, so about 20 minutes. We sat there, chat, BS'd, it's just, and it pops up on your app every time. Boom, reminder, test, scheduled, where it's at. So the third test that was trying to get done, but it was getting late in the day. So by that time, I'd been there for probably 4 hours ish, and it was a Friday. So the lung test that I need to do is rescheduled for Wednesday of next week. But in any case, so your first visit, prepare for being there for a while. Pack a bag. Layers. Some of these rooms are pretty cold. I was wearing jeans and a shirt, button-up shirt. I didn't bring a backpack. I just had my phone, and that was pretty much it. But your first visit, I would bring a backpack, bring a book, bring some games, prepare to be there for a while, because it's not just the doctor visit like I thought. I was able to get my lab work done and get my EKG done, all in the same day. So again, one of the benefits of MD Anderson is everything is on site. You don't have to go anywhere. I mean, if you need, it's all there. Another bonus. Big fan of MD. They got a barber shop. I saw signs for that. They got a gift shop. This is I don't know, it says University of Texas, MD Anderson. I'm bought in, guys. I'm a big fan of MD Anderson. I can, just a positive place. So yeah, pack a backpack, or ladies bring a purse, bring some games, some snacks. I haven't seen the cafeteria yet. I don't know about the food. I've seen the gift shop. I've seen a bunch of the other offices, but not the whole thing. So that was it. Just for numbers, to give you an example, we left the hospital at 4:00 p.m. on Friday. It takes about an hour to get back to my sister's house from the hospital. By the time we got back, I had 30 messages on my app. So your app is broken down into different categories. One is to do. If you have stuff to do, you have questionnaires, you have a form to fill out, it'll pop up and it'll give you a notification. It'll say one notification, things to do. Appointments. If you have a new appointment, it pops up. 4 new appointments. what else is on there? So there's appointments, there's schedules, there is, so the other category is test results. By the time I got home, I think it was 21. So from the time I left to the time we got to my sister's house, I had 21 test results on my app. And I started opening them up, and it was my blood results. They took, from the time I took my blood to the time they popped up on my notifications, probably 2 hours maybe. And I had all my results. Couldn't read them. I don't know what the heck half of them meant, but they're there. And that is, it just shows how you go to the #1 cancer hospital in the nation, top 3, however you want to look at it. This is what you get. You get top care. You get great people who are patient friendly. You get the technology. The app is amazing. All your contacts are on there. Your oncologist team, from your nurse practitioner to your doctor to your head nurse. You have a question? Boop, send an email. It's amazing. And so yeah, that would be my advice for your first time visiting. One thing about parking. So parking is a thing. Parking is, I'm gonna get these numbers wrong, but there's a cost to park in the parking lots. MD Anderson has sub-campuses, like the Woodlands. I don't know Houston that well, but there's one in the Woodlands, which is close to my sister, but it's not the main campus, and they lack some of the technology there, but the parking's free. So once you get to see your doctor, you can seek treatment at other sub-campuses in their portfolio, because there's a cost to park. I don't know what the cost is. I think it was like, I'm gonna screw it up, but it wasn't LAX airport expensive, but there was a cost to it. So yeah, I guess that's probably about it. If you have any questions, send me a message. Other than that, so today's Sunday. We are going back on Wednesday. We have the lung test on Wednesday, and then we're seeing Dr. Lee on Friday again. So everybody have a great day, great Sunday, and God bless. Love you all, and talk soon.